what is emergency department? What things will be done in the emergency department and how it is different from casualty? So that's the thing which I'm going to discuss in this session. So basically, you must have been to a hospital whenever there is an emergency. So what happens in the emergency department? So whenever a patient goes and have some complaints such as chest pain, such as accident, such as pain in the abdomen, so what will be done? So we need to have an urgent diagnosis. We need to start immediate treatment. We need to resuscitate the patient. And if you do all this within a golden hour or within immediately the presentation of the patient, the outcome is very, very good. The mortality, morbidity is significantly reduced when a patient presents to emergency department. Now, how are we different from a regular casualty? We emergency physicians across the country and globe are trained physicians who can handle any emergency irrespective of the age, irrespective of the case, irrespective of the presentation and what needs to be done. We are all trained to handle that acute crisis during emergency. Now, what we do, we usually tend to treat the patient immediately within the arrival of the patient, and we see the diagnosis, we come to a conclusion, and we decide which specialist needs to be involved. So let's take an example of acute heart attack or myocardial infarction, what we call in medical terms. So you come to emergency department with the chest pain. So what do you expect? Immediate acute decision to the plan of action, what needs to be done, that is all you expect as a patient. So we emergency physicians, we do an ECG, we come to a diagnosis, we give you a plan of action, we start the immediate treatment, the basic treatment, the first treatment, so that we are ready till the time the cardiologist arrives in the cath lab and is ready for the primary intervention, which is the golden treatment for the acute heart attack. Now let's take an example of stroke. So when a patient is present with symptoms of stroke such as weakness of the arm, weakness of the leg, difficulty in speech, difficulty in walking, or deviation of the mouth, these are all symptoms of stroke. So when you come to a department with these symptoms, we suspect a stroke immediately. There's a code activated across the hospital and imaging is done, radiological imaging is done immediately. And with the loop of neurologist and experience of the consultant in ER, we tend to even thrombolize the patient without waiting for the neurologist to arrive and see the patient, then decide about the treatment part. So this is how the emergency department functions. Whereas in casualty, where there are normal TMOs, RMOs, where they're not that trained in handling acute crisis, they will be taking multiple opinions over phone, they'll be taking multiple opinions over from the seniors. Now what is happening here? There's a delay in the treatment, there's delay in the golden hour. So any patient who doesn't receive treatment in the golden hour and there is a significant delay, each minute counts when it comes to emergency, especially in heart attacks, especially in strokes, especially in polytraumas. So I urge everyone, whenever you have kind of emergency, irrespective of whatever it is, please do come immediately to the hospital. Instead of going to a nearby medical shop, taking primary therapy by an unqualified person, I would urge you come to emergency department, rule out all the emergencies, and if there is nothing, we will discharge you home. But if there is something, trust me, your life is gonna get much easier and you'll have long years to live. There are presentations such as sudden cardiac arrest, unconscious patient, without any pulse, without any heartbeat. So what do? Do we wait for the senior opinion? Do we wait for the phone calls? No, right? So that is where the difference between casualty and emergency comes in. We start the resuscitation without any delay. We take the patient out of ventilator tube and we start the CPR. So when a patient who presents immediately to the emergency department and gets resuscitated by us, the outcome is usually good instead of delay presentations. Now let's take an example of a polytrauma. So whenever a patient presents with a polytrauma, he might be having an injury over the head, he might be having an injury over the chest, he might be having a penetrating injury of the abdomen or a blunt injury which has caused some leak in the abdomen. You need some skills to identify these emergencies. And if you don't have these skills, and if you don't initiate the resuscitation within the golden hour, the mortality is nearing the patient, or even if the patient is survived, the morbidity is very, very bad. So this is the difference of getting resuscitated in the golden hour. The golden hour treatment, the resuscitation by an emergency physician, matters a lot when it comes to the mortality and morbidity of the patient, irrespective of the condition. Thank you.